Well, Dr. Gersh, I am so excited to welcome you to the Core Connections podcast today. I know we're going to have such a great conversation, and I am so excited to learn so much from you, as I feel like I already have, which is why I wanted to get you on here today to just share so much of your wisdom and encouragement with women. So I'd love to have you start with just, can you share with my listeners, like, where you got your start or interest in, really kind of specializing in helping women with PCOS, women's health, hormones, all of that?
Well, as so many in medicine have as their background, I went into an area that had a personal touch for myself because I knew something was quite wrong with myself way back when I was, well, even in my late teens, because my periods started on the later side. I was almost 15, and they were always irregular. And I developed what was like really far worse than the average teenage acne case. And there was nothing that anyone seemed to be able to do for me. And so I don't know where I got this idea, but I figured it must be that it's not clean. My skin just needs to be cleaned. And so I took rubbing alcohol and put it on cotton balls, and then I would just scrub my face with alcohol until it just cracked. But of course, it had no impact on the pimples, but I had totally dried out, cracking skin around the pimples. And it was so discouraging. And nobody gave me any kind of a diagnosis. So I went on to college, and I decided I wanted to go into medicine. And then I just kept dealing with it as best I could. And when I was rotating through, in medical school, you rotate through different specialties. And when I rotated through OBGYN, I said, this is what's for me, because I loved the variety, because you worked in the office, you saw patients, you also did surgery, you also had that incredible adrenaline rush, which I loved, when you delivered babies. And it was such a happy field. I mean, you very rarely dealt with like life and death issues, and mostly you were dealing with really happy things and helping women. So I decided that was for me. And then I went into the specialty. And while I was a resident, I went to see one of the top honchos in my department. And I said, Dr. So-and-so, I mean, something is clearly wrong. At this point, I hadn't had a period for 2 years. I still had acne. I'm in my very early 20s. And he just said, just go on birth control pills. I mean, like, you don't even want to be pregnant now. And no, women don't even like having periods anyway. So it's kind of fine. Just go take a birth control pill. And it's like, but what's wrong with me? Why is this happening? It's like, doesn't matter. And well, being obedient, I went on birth control pills, and they made me feel really nauseated, and I didn't like it. I tried to stick with it for a while. And it was only a little bit later on, when I was further in my training, that I started doing more research. And I said, hey, the light bulb went on. Like, I actually have a variety of, like the lesser common type of PCOS. And I just had to find my own way, because there really weren't any treatments that were addressing the underlying cause. So, I did a deep dive, I researched, and it was always in the back of my head that I would write a book about it. It took many years and many patients. And I also saw the incidence of PCOS dramatically rising as the decades passed in my practice. And also the manifestation seems to be getting worse and worse. And like, what is with this explosion of PCOS now, and worse kinds of degrees of PCOS? So it became just a passion of mine to understand it, to be involved in it. I became one of the consultants on the medical board, advisory board for the different PCOS nonprofit organizations. And I started speaking and helping them to raise money. I became an advocate on Capitol Hill, trying to educate legislators about the importance of educating and funding research at the NIH on PCOS. So it's just become just one of my pet projects is to help women all around the globe with PCOS to understand its origins, why they have it, and ultimately, of course, what they can do about it so that they can optimize their health, their lives, and their happiness.
Well, I love it. I love that it's such a passion of yours because we need amazing women like you helping to help other women. So, can you explain to everybody, like for those listening that are like, I've heard of PCOS, but what really is PCOS? And then what are the common symptoms of PCOS as well?
PCOS stands for polycystic ovary syndrome. It gets its name from the common but not required finding on ultrasound of many, many tiny little cysts on the ovaries around the rim or cortex of the ovary. That's where its name comes from. In terms of how you get the diagnosis, it's I don't want to call it concocted, but kind of it is. You had a medical committee, a bunch of doctors got together and they made up the definition of what PCOS is. And whenever you hear the word syndrome, like polycystic ovary syndrome, you know that it's going to be a large spectrum of degrees of problems, and that it's not going to be probably all one thing. And it isn't. And a lot of people don't realize that. But in order to acquire the label of being a PCOS lady, you need to have officially, you need to have two of the following three. You have to have irregular cycles. You have to have clinical or laboratory evidence of elevated androgens, which are the male type hormones that women have, of course, but in a much smaller degree compared to men. And that would be like testosterone and DHEAS, which is the key adrenal androgen. And then lastly, the ultrasound findings. So you need two of those three. So, and this was quite controversial because you could actually have the label PCOS and not have any evidence of elevated androgens if you just have irregular cycles and PCOS ovaries on ultrasound. That was quite controversial because one of the main organizations, the Androgen Excess PCOS Society, they felt it's an androgen excess condition. And in fact, when you look at what's going on, from a physiologic point of view, what's happening in the body, it really does involve excess androgens. Now, the good news is if you go into what I call remission, okay? So if you treat it and you live the proper lifestyle and so forth, you can go into what I call remission and the elevated androgen findings will go down and you would still have the label, but you would lose that really most unhappy causing, problem of elevated androgens.
So I want to get into what we can do and stuff in a minute, but you had hit on something a little bit ago about we're seeing a rise in PCOS. And why is that? What is your take on why that's happening?
Well, I think it's a multitude of factors. One is the ubiquitous exposure of young women and in utero, which is probably the key time, to what are called endocrine disruptors. The most commonly studied one is BPA, bisphenol A, which is found in cash register receipts, can linings, hard plastics, and even dental sealants. So it's actually in everyone. At least 90% of people at any one time will have elevated levels of BPA. Now, originally, they said, oh, don't worry, we tested pregnant women and it's really not in high levels in them and it's not significant. And of course, that's not true. And the other problem is it turns out that it actually concentrates in the fetus. So whatever level is in the maternal blood, it's actually a multitude of that level in the fetus. So these endocrine disruptors like BPA, which actually works across a number of different hormones, these chemicals can interfere with the very development of the endocrine system in a fetus, how the receptors form. So every hormone is like an information delivery system. And in order for it to create the effects that it needs to create in terms of delivering the information to the cell, it needs to bind to a receptor. So it's like a spaceship docking at the port. It's got to land, and it's got to then deliver the message. Well, in women who are exposed to this chemical, and I'm sure many others in utero, those receptors don't actually form properly, so that the hormone can be circulating, but it doesn't matter. It can't dock. It can't deliver the information. So the cell is like completely clueless, like, I don't know what to do. So it doesn't do the right thing. And it also can bind, not only does the estrogen not bind properly, but the chemicals, these endocrine disruptors, can bind to the receptor and deliver the wrong information. So it's like a double whammy. You don't get the right information, you get the wrong information. So that's a big part of it. The other is what we call the standard American diet, or the Western diet, which is just filled with garbage. People are eating non-food. And the reason I know that is I had to go and look up in dictionary.com the definition of food, because it's like, what are these people consuming? Well, it doesn't actually meet the definition of food, because it has to have nutrition. And these items that are being put in the mouth have no nutritional components that are useful. So people are eating stupid foods or non-foods, and these are wreaking havoc with the gut microbiome, these trillions of little microbes that live in our gut. And now we know it's not just bacteria, although that's where the focus has been. It's also viruses and others. And we have the virome. There's been much more research just in the last couple of weeks on that. So we have the wrong little critters living in us because they're not being fed properly. They're also being killed by the pesticides, the herbicides, the additives, and like things like glyphosate that are in GMO foods. And of course, all the antibiotics that are given both to children and people directly, and also they get it through the food that they eat because they put it into the animals that are then consumed. So we have this whole array of toxins and poisons, and it's not just what you eat, it's what you don't eat. You're not eating enough fiber and plant-based foods that have polyphenols and all the nutrients that help to create a healthy microbiome. We're eating at all weird times of the day, and we know the microbiome needs to be fed on time so that you get the right microbial population. So we have this disastrous issue with our gut microbiomes. And also we have crazy light. We're so filled with blue light at night, with screens, television, the fluorescent light bulbs that are playing havoc with our circadian rhythms, which are also key to having functional, optimally, acting ovaries. We now know that this is really critical. Ovaries are very circadian, and when you have light at the wrong time, you don't make proper melatonin, they don't function properly. So we have so many of these different factors coming into play that are really wreaking havoc with our reproductive systems. And then on top of that, and this is my own theory based on observation over now many, many years, is that the common use of birth control pills and other hormonal contraceptives starting in very young girls. I mean, we're talking 13, 14-year-olds are being put on oral contraceptives, and I call them similars, hormonal contraceptives, which completely stop them from making their own natural hormones and change all the microbiomes in the body, change so many different things. And also, I am 100% sure based on my observation, but I don't have proof of this at this time, that they also, over time, when women are on them, as they are so often for at least a decade, sometimes 20 years. I mean, they're put on them when they're 24, and when they're 34, 24 years later, they say, now I want to get pregnant, and they've been on no hormones of their own for all those years on these chemical endocrine disruptors, which are what birth control pills are. And then they go off of them, and their own receptors or hormone receptors have been modified in ways that they don't work properly. So essentially, we're creating PCOS in women who otherwise wouldn't have it, because you're creating a situation where the hormone receptors aren't working properly. You've altered the gut microbiome. Essentially, you've created the perfect storm for PCOS to develop in women who otherwise wouldn't even have it. And so they're going off the pill and having an explosion of PCOS, with terrible testosterone production because their ovaries are not properly converting testosterone into estradiol, because the enzyme aromatase isn't working properly, the estrogen receptors are not working properly. So we're basically creating the same situation that occurs naturally in PCOS in women who are predisposed genetically and have the prenatal exposures and all of that. And now we're creating it. We call it iatrogenic. We did it, we did it to people in medicine. And no one's acknowledging this. And when women go off birth control pills, just as a trial, even they're not interested in getting pregnant, and they have this explosion of testosterone and PCOS, they're diagnosed with PCOS, and then they're told just go back on the pill, which of course is just going to perpetuate or kick the can down the road, because whenever they actually do go off, they're going to be in trouble. And these are the same women, if they're on birth control pills their entire reproductive lives, which happens, and then they go into menopause, they are usually in much worse trouble, because if we give them hormone replacement therapy, the hormones aren't working properly because of the receptor problem. So it's such a huge problem, the sort of just prevalence of putting chemical endocrine disruptors in young women. And I think that's also predisposing to this epidemic worldwide of PCOS.
Oh my gosh, there's so many things. So I do have a question, because I know my ladies listening are going to be like, okay, so whether it's for themselves or, as their daughters are getting older, I have a 14-year-old. And so of course, this is something I'm like, at some point, way down the road, but what do we do with birth control then, right? Because that's the easiest, most every woman has been told that, and they're thinking, okay, well, what do we do instead of being on birth control? For two reasons. One, obviously preventing pregnancy, if that's a goal of it. The other one is then I have these slew of PCOS symptoms or whatever else it might be. I mean, I know women that have just been put on birth control for acne, or because they do have cysts or irregular periods or whatever it is. So what are any answers or directions or ideas for women if birth control is out of the picture, because they're like, I don't want all those endocrine disrupting for myself or my daughter or, all of that. Because it's a tricky situation.
It is. And I'm not going to underestimate the issue. For the present, I'll go over the options, and it is certainly not optimal. And we will never do better if we aren't honest about what we're doing. I mean, that we're basically putting slow poisons into our young women. And this is not acceptable. I mean, it's just totally not acceptable. And when birth control pills were first invented, like 70 years ago, no one even knew what estrogen did in the body. No one knew what it really meant to go on these chemicals. All they knew is that they disrupted the ability to become pregnant, which was useful. But on the other hand, and then it was, of course, promoted as a woman's right and women's lib and all that. But it's such a weird thing when you understand what these chemicals are and what they're doing in the body. It's like, well, yes, I definitely want women to be able to control their reproductive destiny, but I don't want them to pay the price of being put on these chemicals, because not only does it predispose to PCOS, but it has a whole host of things that we could talk about for ages, because you don't have your own natural hormones, you don't have your natural rhythms, and so on. So what's out there now is limited. For those who are willing, we can do a lot, though. If they're willing to be fitted and use it, a diaphragm, which is very old-fashioned. I actually have to special order them now. You can't even usually go to the drugstore, but I can order them. They're still made. And I can fit a young woman or any female with a diaphragm, and they just put it in and out. And they're so used to it now, because it's a lot like some of the contraceptives that are, not the contraceptives, rather the menstrual products that are being used, where they put in like these little catch-alls and things that are put in the menstrual cups and the menstrual discs and so on. So a diaphragm is very similar, like to a menstrual disc. So they're capable of doing it. And they put a contraceptive gel around the rim and inside the cup, and then they put it in, and then they use it 100%, with the male also using a condom, which of course every single female should insist that the male that they use a condom 100% of the time. There's like no exceptions. So if they use those two together religiously, that is very effective. And then there's also, you could use the contraceptive acid product, the Phexxi, that's out now. So you have to use, I feel that for young women, they need to use two things at a time, not one. If they're using these other, we'll call them lesser effective, they're not really particularly less effective. When you talk about contraceptives, there's two ways of grading their efficacy. One is called theoretical, the other is use effectiveness. So theoretical is based on, well, you use it correctly 100% of the time. Well, when condoms are used correctly 100% of the time, their efficacy is about 98%. But in real life, their use effectiveness is considered to be 80% effective, because they're included in that 80% are people who don't use them. Okay, so like, oh, I meant to use it, but I didn't. Okay, well, that goes into that calculation of 80% effective. So if someone is going to say, I understand what it means to have sexual activity, that I'm putting myself at risk for sexually transmitted infections, I'm putting myself at risk for pregnancy, and I'm going to insist on being a responsible individual, then you can do these like alternative things. Now, if that's not going to happen, or you just know that you just don't want to live with that, then although I don't love it, it's sort of like you got to pick your, what you're going to go after. So I would pick a copper IUD. Now, it's not for everyone, because in some women it can make periods more painful or heavier, but not usually in women who have normal periods. So it's really important to work for women to have normal periods, because the menstrual cycle is a vital sign of female health. So if you have a problem, irregular cycles, cramps, heavy bleeding, any, PMS, if you have any issue relating to having menstrual periods, the solution is to find out what's going on in the body, whether it's a nutrient deficiency, stress, sleep deprivation, whatever it is, there's obviously too much inflammation going on in the body. And so the bottom line is that you've got to fix the period, not cover it up. So my analogy is, if you have a wall that's filled with mold and termites, the solution is remediation of that wall. It's not to cover it with wallpaper, but that's kind of what we're doing when we take women with abnormal cycles of any sort and then putting them on some sort of contraceptive thing that, with these chemical endocrine disruptors that they call hormonal contraception, and then cover up the problem. You're not fixing the underlying issues. This is such a warning sign. It would be like if someone was having chest pain because of poor circulation in the blood vessels, the coronary arteries of their heart. You wouldn't say, okay, I'll give you codeine, and that's the end of the story. I'm just going to medicate your pain. No, that person is probably going to ultimately have a heart attack, because you're not treating anything. You're just covering it up. So that's what we're doing with all these young women when they have menstrual problems, and we don't address actually fixing their periods. Instead, we just cover it up with the contraceptives, with they're actually hormones, but they're not human hormones. So technically, they really meet the characteristics, and they're actually labeled as such in the toxicology website for the National Institutes of Health. They're endocrine disruptors. Endocrine disruptors are chemicals that will interfere with the production, distribution, receptor function, degradation, elimination. Virtually every function that a hormone has can be affected in a negative way by an endocrine disruptor. And it would be like telling women, well, you have bad periods, so I want you every day to lick this like melted plastic. I mean, that's as bizarre as it sounds, that's exactly what we're doing, because some of the chemicals that are actually now in pharmaceuticals, are not so different from the chemicals that are actually in plastics. And some of the chemicals in plastics, like BPA, actually tried to become a pharmaceutical. It actually came on.
Oh my goodness.
It was actually presented as an estrogen, even though it's an endocrine disruptor for estrogen. And other BPA is more complex. It actually interferes with testosterone's elimination as well. So it has multitude of problems associated with it. So the bottom line is that it's not optimal, that we have different forms of barrier contraceptives that are quite effective, especially when you use them in combination. And as well, there's still the copper IUD as another option. And although I don't like it, if I had to choose among hormonal contraceptives, I'd probably choose the progestin IUD, because it doesn't 100% of the time get rid of your estrogen production as does, the oral contraceptives or patches, but it has, this chemical in it, levonorgestrel, which is a known endocrine disruptor and certainly not a health item.
Yeah. Oh my gosh. Thank you for sharing all of that. I think there's so much around birth control that we're just learning in the last, I don't know how many years it's been, and so I wanted to mention and ask you something, because from my own experience, with myself and everything I know about health and hormones and all of that, is so much of it seems to come back to the gut, which ultimately, right, the BPAs, the plastics. I mean, and I think like that's one of the biggest things is get the plastics out. But when we're looking at hormones, and even like young girls who are starting their cycles and they're just not, they're heavy, or they're not regular, and they're having cramping and all that. Cause I had problems since I started mine at 14. I had my very first like crazy big ovarian cyst rupture when I was 14. My parents rushed me into the ER. They thought I was having they thought my appendix had burst. And so, doctor like takes me into surgery, cuts me open and siphons out all the blood or whatever was in there. And then he went ahead and took out my appendix as well. And I'm like, whoa, wait a minute. Like that was not okay. And to look back and recognize like, okay, I'm so glad we're having these conversations now, and women and, no matter what age you are, or teens, can start to recognize like we can actually have such a handle on what's going on with our hormones. Like I have a friend who, her daughter was starting like early puberty, and she switched all of her food to organic, and it paused all of that puberty for a couple more years. So she wasn't, starting her period at 9 kind of thing, because I know we're seeing more and more of that with young girls. And I think it kind of leads into the same conversation. Would you agree that early puberty that starts is also in correlation with the toxins, the BPA, the non-organic food, the antibiotics, the pesticides, and what it's doing to our gut microbiome and all of that? So do you have more to add about I know we can talk about this for hours and hours, but I think specifically like helping to correlate for everyone listening, like really the gut and hormones, because I've heard all my life and had women tell me like, oh, well, your acne, it's from your hormones, or this, it's from your hormones, or my hormones, right? It's all hormones. Hormones get labeled like the bad rap, but it's ultimately our hormones come really from our guts. And so can you help like clarify that for everybody? So
well,
our hormones stop getting all the bad rap, because it's not always our hormones.
Well, we do have an epidemic of hormonal imbalances and dysfunctions, but they're the victims, not the perpetrators. Right now, there's so many reasons for why women are having such irregular cycles. So we have what we call the hypothalamic, pituitary, ovarian, adrenal, and then axis, but you can add in a whole bunch of other things. So the things that go into play that influence the ovarian function and production of hormones or a multitude of things. And one of the things is inflammation. Now, we know that when women, for example, with PCOS have follicular fluid removed from around their follicles in their ovaries, they find that it's filled with inflammatory contents. Lots and lots of inflammation is going on in the ovary. An ovary that's inflamed is certainly not going to produce hormones in the proper sequence. Now, why would an ovary be inflamed? Well, you hit it on the head when you talked about the gut microbiome. So the gut microbiome is so critical for our immune function. So it turns out that about 70% of our immune system lines our GI tract. And when you have the wrong microbial population in the gut, you're eating the wrong foods, you're eating at the wrong times, and so forth, you will have the wrong microbial population. And when this happens, you don't produce the right metabolites called short chain fatty acids. These are butyrate, acetate, propionate. These actually signal to our liver, to our brain. They have receptors on this big finger of nerve that comes from the brain called the vagus nerve, which is what keeps us calm and peaceful. And none of this is happening when you don't produce the right short chain fatty acids because you have the wrong microbes. So, and once again, it's not just what you're not producing, it's what you are producing. These abnormal microbes, we call it a dysbiotic gut microbiome, they're producing toxic particles called endotoxins or lipopolysaccharides. And because you don't have the right microbes, you don't produce the important mucus protective lining in the gut that protects the lining cells from the toxins that are in the gut. So you lose that protective barrier, and then you have these toxins that come face to face with the lining cells called the enterocytes, and they damage them and cause them to start moving apart. So we call that impaired gut barrier function or leaky gut. So now these particles or these toxins, endotoxins in the gut, actually pass through the spaces between the cells into the associated gut lymphoid tissue that lines the gut, where all these immune cells are lined up, ready to fight a battle, like if you get food poisoning. So now you have this perpetual toxic entry into the body, and they activate the immune cells that are there. And what do the immune cells do? They produce an inflammatory response, because that's our body's innate response to an infectious pathogen or to damaged tissue, is that it creates an inflammatory response. That's a life-saving issue. But when you have it chronically happening in the gut lining area, and then these inflammatory cells circulate through the body, releasing their inflammatory contents, including in the brain and everywhere, and even in the ovaries, you're going to have a chronic state of low-grade systemic, that means total body inflammation, including in the ovaries, you have inflammation. Now, one of the key antioxidants in the body is called melatonin. Now, we did not know until relatively recently that the ovary has melatonin receptors, and melatonin is very important for reducing inflammation in the ovary, which then leads to a whole array of period problems. Also, this extra inflammation develops in the pelvis, in the uterus, which will then give you more cramps. So things that are normal and natural, they become more exaggerated. So you're always supposed to have a tiny bit of cramps. That's like mini labor to help push out, have the uterine muscle contract to push out the dead and dying lining. But it's not supposed to be overwhelming and disabling. But when you have too much inflammation, you have too much of the inflammatory prostaglandins produced in the uterine cavity, and you get an overwhelming amount of menstrual cramping. The uterus is actually contracting. They've shown by putting pressure monitors, it's actually just excessive contractions of the uterus due to excessive inflammatory prostaglandins. All this inflammation is circulating in the body, including, like I mentioned, in the brain. So you get this now epidemic of anxiety and depression. And because you don't have the right short chain fatty acids with their, like the butyrate binding to receptors on the vagus nerve, you have an upregulation of the autonomic sympathetic nervous system, which is the stress response. And as I mentioned, part of the ovarian axis includes the adrenal, which is the stress organ. So now we have a high level of chronic stress, and stress will affect how the ovary also produces its hormones and its beautiful rhythms. So you have a multitude of issues. So if you don't get enough sleep, if you have chronic stress from any reason, if you have inflammation in your gut because you're eating the wrong foods, you're eating at the wrong time, all of these issues, if you don't have the right nutrients so that things are not working properly, the cell machinery isn't working properly, like you're deficient in like magnesium, selenium, B12, B6, B2, all the, the critical vitamins and minerals, then the cells can't work properly. And then you end up with an inflammatory state as well. So it's the perfect storm that's come to play havoc with women's periods. And instead of our conventional medical system saying, wow, we have a lot of medical problems ongoing here. We have a lot of dysfunction. We need to go back to basics, like what are people eating? How are they living? By the way, a sedentary lifestyle increases inflammation as well. So get off your duff, right? And start moving.
Moving.
All of these things, and like I said, emotions, stress will actually, and we have so much stress that people have in this world. So all of these things come into play. And instead of the doctor saying, well, clearly in this young woman who's having irregular cycles and menstrual terrible cramps and all these issues, heavy periods, obviously something is intrinsically wrong with her. We need to help her to be healthier. So we're going to start with foundational things like what you're eating, when you're eating, sleeping, exercise, all these things, relationships, all these things, stress management. Instead, they just give out the magic pill, which isn't really so magic, because a lot of people now are brainwashed into thinking that there's a magic pill for everything. And in reality, no, it's all hard work and getting back to basics. And we're just losing, the whole understanding of what's going on in the female body by medicating with drugs that basically get rid of our beautiful hormones and cycles and create this artificial scenario, which is not healthy. And long-term, it's like a house of cards. Okay, so, so
well said.
Oh my gosh, we just have to understand as females, we actually need our real hormones in the real rhythms.
Yeah. Okay. So Dr. Gersh, that was so well said, by the way, that I love, thank you for saying all of that. Because I'm always trying to explain to everybody, everything's so interconnected, right? So I do want to ask specifically, because you've been talking about, the timing of eating. What do you recommend? And do you recommend any little bits of intermittent fasting for women that deal with irregular periods and all of that?
Yes, we do know that everything in the body is on a time clock. So about 1/3 of all the genes in the body are what we call clock genes. And when you add in the associated genes, so they're related and they function with the clock genes, it's like 90% of our genes are either clock genes or related to clock genes. And then, of course, in our brain, sitting atop the optic nerve, we have the master clock, a group of neurons called the suprachiasmatic nucleus. And this is like the master timekeeper or the conductor that puts out signals to all the different organs in the body to help them work in synchrony. Like we wouldn't want the liver to be working in a different time zone from the stomach. It's like we don't even think about these things. Like we need to have all our organs work in concert together to have a happy, healthy body. Well, we have the master clock. And unfortunately, in women with PCOS, because of hormonal imbalances, stress, the adrenal, the estrogen is not working properly. All of these hormones are very key to maintaining the proper function of the master clock, it drifts off. So it's off the beat. It's like a drunk conductor. It's like not quite all there. So what we do is, I call it the backdoor way. Knowing that we have all these clock genes throughout the body, it's like another way to help get all our organs working in synchrony. And the way we can do that is through timed eating. And we have so much data on this. Well, it turns out that humans are designed to do certain things at certain times of the day. For example, our immune system is completely different in the day and in the night. That's why we now know that you can have a different effect with vaccines, for example, if you give them in the morning or at night. You have different responses because the immune system is really different. It's most active in the morning because we're designed to go out and do things in the morning where we might get injured, or exposed to things. So we have the most active, and then we have a different immune system in the night when we're sort of like repairing and cleaning things up and so on. And we also know taking medications can vary in terms of their efficacy. So we have a whole new world called chronotherapeutics, the timing of everything, the timing of medications and so on. Well, it turns out that we are most functional in terms of our digestive system in the morning. That's why people tend to have more indigestion, acid reflux when they eat at night, because we're not designed for that. We're designed to eat in the early part of the day. We are more insulin sensitive in the morning. In other words, if we eat our food in the first half of the day, it will not raise our insulin levels and our glucose levels as much. And the cells will get the necessary food it needs. The glucose will get into the cells where it can then be used for energy. So if you eat more of your food in the morning and less of your food at night, you will be better served. In addition, in terms of the gut microbiome, they have clock genes too. So they don't know if it's night or day. They know the time based on when they're fed. So it's a little bit like Pavlov's dogs, their mouth will water if they, ring a bell. So if you eat at the same time every day, your microbial population will get adjusted and you will actually have better function because the microbes are very metabolically active. They actually make hormones, they actually make vitamins for us, but they do things at different times of the day. In fact, we know that they literally swarm like insects in the presence of melatonin at night. But of course, you've got to have the melatonin and you've got to have it at the right time. So if we can try to stop snacking, so if you constantly are feeding, then your microbes don't know what's going on. So if you don't eat more than 3 times a day and you stop snacking, you have no calorie intake except 3 set times a day, preferably with a large breakfast. And if you can't do a large breakfast, then do a large early-ish lunch, because you have to be flexible, I understand. And then try to have an early, I realize people go out and they have dinners, parties and whatever, but for the majority of the time, try to stop eating by 7 p.m. earlier if you can, and try to make dinner your lightest meal. Make it like a bowl of vegetable soup or a light salad, something light, and your gut will work better. You'll be happier. And by the way, you'll maintain your weight better because we know from studies that you can eat the exact same food at night or in the morning. If you have like 1 meal a day, if you eat the food in the morning, you lose weight. If you eat the food at night, you gain weight. It's the same exact food, the same number of calories, because it's not just what you eat, it's when you eat and your metabolism response. So if you really want to be optimally healthy, which I hope you do, then try to eat more of your food in the first half of the day, preferably breakfast or secondary lunch and dinner light, and stop snacking. This whole concept of you have to keep eating every 2 hours to maintain your blood sugar is totally weird. We would not be alive. The human race would be long since extinct if we had to eat every 2 hours. In fact, our bodies are designed beautifully to go without food. And that's where it's a little bit more advanced. But I do recommend longer term fasts once you get sort of adjusted to like time restricted eating and you get healthier. I never start with fasting, like multi-day fasting. And I prefer using the fasting mimicking diet which was designed at the Longevity Institute at USC, because it's more doable. It doesn't matter what you recommend if nobody's going to do it. And, you can tell people, I want you to have nothing to eat but water, just drink water for 4 days and do that every month. People aren't going to do it, so maybe they do it once. But if you say, well, you can eat this food for 5 days and it gives you the same effect as if you water fasted for 4 days, it's much more doable. So you got to be pragmatic, and it's no use recommending things that nobody does. So I find the fasting mimicking diet is very helpful for helping to reboot the gut microbiome, for helping with weight control and mood issues. So I have found it to be very invigorating for myself and for my patients, but that's not where I start. I wouldn't get into that for at least several weeks after you start time-restricted eating and getting the gut microbiome healthier and supporting the liver and working on all the lifestyle issues that, involve sleep and movement and stress and so on. And it's amazing how so many things in the body will improve. And it's like inflammation goes down, so joint pain goes down, mood goes up, sleep is better, and then periods actually start to become regular and less painful. So everything is amazing in the body when you realize how resilient we are, and that we have, like in the brain, we have what's called neuroplasticity. The brain can actually create new connections and rejuvenate itself. And our bodies are designed for healing and rejuvenation, but up to a point. Like, we don't know how to fix end stage disease. Like, if someone's in end stage heart failure, renal failure, if once their bones are so severely osteoporotic, they just break, with just a tiny little injury of any sort. I mean, we can't fix end stage disease. That's why it's so important to be proactive and get on things at a young age, and the earlier the better with everything, because we just are much better in, we'll say, functional medicine, integrative medicine, with prevention than we are with repairing end stage disease. I mean, realistically, we can always help at every stage, but we're not going to fix things that are already beyond repair. So we have to get on these things early and not create the setups so that we'll end up in terrible states in 20 years and so on, by starting young girls on birth control pills when they're 13 and 14 and having them stay on it indefinitely, while not even addressing anything concerning all their other aspects of life. It's mind-boggling, isn't it, that we would do such things in our medical community.
Yeah. And there's so much more that can be done. And the thing is with all of this, it's like picking one thing and starting to implement that, and then picking another thing. And, it's like, don't feel like you do everything, right? But picking that one thing that stands out to you right now, and just slowly, those slow lifestyle changes. I mean, I think of where I'm at now, it's very different than where I was even 2 years ago and 10 years ago and 20 years ago. Right. So we're always all evolving and making changes. And that's sometimes the best you can ask for. It's just like one foot in front of the other, and making those small, healthy lifestyle changes.
I mean, once you see food the way I see it, which is very easy to get to that point, it really is, like, if it's coming from a factory, it's in plastic, it has chemicals in it. I mean, it has no appeal to me whatsoever. And if you stay away from it after a while, it tastes weird too. It's amazing how our taste adjusted to weird chemicals. And food that comes like fresh from the farm, like from your farmer's market, it has a different flavor. There's a reason why kids nowadays, they don't even want to eat things like apples and strawberries, because when they're grown on conventional farms, they're like refrigerated for months at a time. They have little flavor. So they want the candy, then it has all that added high fructose corn syrup and such. But when you get fresh grown vegetables and fruits, a tomato from a hothouse that's sitting in a warehouse in a cooler for months doesn't taste anything like a freshly picked tomato. Even people who don't have a lot of space can, grow all kinds of things in containers, these little container vegetable gardens. and grow a few fruit trees or go to the farmer's market. I mean, it's, get the best that you can. I say, if you have to buy used anything, use furniture, used pants, whatever, but don't buy junky food.
Yes, I agree with that.
Oh my gosh, do whatever you can to buy the highest quality food that you possibly can get. And farm to table, skip the middleman, try to get it directly from the grower if you can. And the taste is so different. And you'll find, like, when you buy strawberries that are freshly picked, you have to eat them within 24 hours. Yeah. You can't let them sit in the refrigerator, they'll just mold. And that's what food was designed to be. Don't get food that can sit like the Twinkies, like we'll eat them in 100 years. No, with the trans fat. No, get food that spoils, but eat it right away, because that's and then just, like the old days, people went to the store more often. You just have to commit, and then it's actually fun, buying vegetables and meeting people, meeting your local growers, and cooking food as soon as you buy it, so that it's still, really fresh, and eating it. It's really fun. And you are also the company you keep. So hang out with other people who feel and believe that health matters, that eating really high quality food is the way to go. So, and sometimes it's really hard and painful, but you have to I don't want to say defriend people, but they've done so many studies that if you hang out with people who have really unhealthy habits, then you will adapt those same unhealthy habits. So, the people that that you care about who really have terrible habits, try to get them to hang out with you a little bit and see your healthy habits, and maybe you'll wear off on them. You don't want it the other way around. Okay. So you'll be the good influence, and then hang out with people more and more who share the same values that you have, because that will reinforce, your healthy habits, like walking with people who care about getting outside, getting sunlight, which makes you happy. I call sunlight the happy medicine, because sunlight goes into the eye, and there are specific receptors for light that transmit directly to the neurons in the brain that make serotonin, the hormone that makes you feel happy and calm. And then serotonin is converted to melatonin, so you sleep better. That's why a day out in the sun makes you feel happy, and then you sleep like a baby, as they say. So, get out in the sun, hang out with people who care about the same things, have dinners together, shop together, and like you said, little by little, incorporate the healthy lifestyle choices. And you won't just be healthier in terms of like getting on the scale or having lab tests. You're going to be happier in your body, because your brain will be less inflamed. And when you have neuroinflammation, we now know that depression, anxiety is really an example of manifestation of neuroinflammation. So your brain will be healthier. You'll be clearer thinking. You won't have so much ADHD, you'll just be happier, healthier, and you'll sleep better. Life will be better. And of course, for those interested in fertility, you will be more fertile.
Yeah, absolutely. Dr. Gersh, this was amazing. Can you just share with everybody where they can find out more about you? And of course, I have your book right here. So
yeah,
I highly recommend it.
Well, I hope that will be like the Bible of PCOS, women. And I do have another one that's for women who are anxious to get pregnant right away. That's PCOS SOS Fertility Fast Track. So I've been a little bit lax for the last month, but generally I do a weekly Instagram show. So please follow me on Instagram at Dr. Felice Gersh. Don't forget the period after the DR for doctor. And I have a practice. I'm actually in an exam room in my office right now. And I see patients with telemedicine and in person, like every day, 5 days a week. And I work one-on-one to help each patient to optimize her health. So you can certainly see me and be my patient if you want. And my office is in Irvine, California. And you can check out my website at integrativemgi.com, because my practice name is Integrative Medical Group of Irvine.
Well, thank you, Dr. Gersh. This was so wonderful.
My pleasure.